Welcome back to DBL. So we're continuing our conversation about the attempt on Donald Trump's life over the weekend with our favorite medical expert, Dr. Coley. Thank you for being here. Let us start, though, with the basics. Trump was hit in the right ear, and his doctor from when he was president is speaking out about the injury. I want you to take a look about this.
There was no concussive effect from the bullet, and it just took the top of his ear off, a little bit of the top of his ear off as it passed through, and it was bleeding like crazy because, the ear's pretty vascular and bleeds pretty badly. And, I bandaged it up pretty good this morning because it's not like a clean laceration like you would have with a knife or a blade. It's a bullet track going by.
So what's the recovery process for an injury like this? Will he need surgery? Is it stitches? What is it?
So this outer part of our ear, it's called the pinna or the auricle, and it's involved in sort of funneling the sound waves into our ear. It's made of cartilage and skin. So as he said, if it was a laceration, just a cut, you could just suture it back together or staple it together. But if you actually have a defect in the cartilage, it potentially could require reconstructive surgery, especially if you want to maintain the appearance of the ear. And sometimes they'll do a cartilage graft, or sometimes they'll even use some synthetic material to kind of fill in the ear. But if you don't want to change the shape of the ear and there's actually a defect, a piece of cartilage missing, you might actually have to reconstruct that. So I'm not sure how much of his ear he lost, but if he lost a substantial amount, it's potentially possible he might need a reconstructive procedure.
Could this lead to any hearing loss? We did see that New York Times picture of the bullet whizzing by. That's really close to the inner ear.
Yes, and so gunshot wounds can lead to all kinds of problems with hearing in many different levels. So one is called acoustic trauma. It's such a loud sound that you can actually have sudden onset, complete hearing loss.
Oh, wow.
The second is the sound and or the pressure that's created by that sort of sudden change near your ear. Your ear feels that pressure, and there's little tiny bones in your ear that help you hear. You can actually fracture or damage those bones. And then we all have these little tiny cells in our ear called hair cells that are extremely sensitive. This is why we always say with AirPods, you don't want to listen to them too loud because they're very sensitive to noises. And if you damage those, you can have that. A lot of people after a gunshot, they hear a gunshot really loud, can have ringing or tinnitus in the ears, and that can be a buzzing. So I hope he's had a hearing test or at least been evaluated by an ENT to check and make sure that nothing internal has happened to the ear.
Wow.
Can you give us your take on Trump's mental state or mental health after the shooting?
Yeah, this is such a tough one. We always talk about President Trump as the president. We don't talk about him as a person. But suddenly now he's become one of the many Americans who's witnessed a shooting. In fact, he was a target of this particular shooting. It's really hard to predict how people will respond. But what the science tells us is that the way people respond often depends on their underlying personality. So people who are more extroverted, like Trump, are more likely to actually have PTSD, post-traumatic stress disorder, after this type of an event, because they can have trouble sort of coping with some of their emotions or really knowing how to process them. They can also have a withdrawal phenomena or hypervigilance, meaning their every sound sort of startles them, and they can react with potentially more aggression. So that's kind of one end of the spectrum, the PTSD, the fear, the kind of amped up. The other end, which we actually saw with Reagan in 1981, was after, he got shot, he actually became more spiritual. And he said God saved him so that he could, improve his relationships with the Soviet Union and such. So it's really hard to predict, but a lot of his underlying personality, as well as the challenges placed on him over the next few months, are going to determine, I think, what sort of response he has. But I hope that he's seeing somebody at least talking about what he's been through, because this is a physical and psychological trauma.
Yeah, we have to say our prayers go out to the Trump family. That is a difficult thing to go through, and then jump back right into the campaign. That's very scary. Thank you so much for joining us today, Doc. DBL Nation, follow Dr. Coley on social media at Pyle Coley MD. Also be sure to subscribe to her YouTube page. Plus, check out her podcast, Heart of Medicine, wherever you listen to your podcast. Thanks again. We'll be right back. Really good info. Thank you.